this year, the city health department is also noticing 3 times the number of whooping cough cases as it did last year. Joining me now to talk about staying healthy through the holidays is Dr. Susannah Hills, a surgeon and assistant professor at Columbia University. So thank you so much for coming in.
My pleasure.
Whooping cough is something that we should be vaccinated against. What's behind that?
Yeah, you're absolutely right, Annika. Yes, it's a vaccine-preventable illness. There's a course that pediatricians recommend across the United States. I think the increase in cases is probably due to fewer vaccinations. The vaccination rate for that particular vaccine, DTA and P, is down to below 92%. This year, it was 95% a year and a half ago. So the vaccine rate has declined. Some of that is due to people exempting out of vaccines for their children. I think some of that also is due to the fact that COVID delayed some of the vaccine schedules. So people are catching up or never got it and never went back to get it when they missed it for their children.
Have you homed in on why people aren't getting as many vaccines for your children? I mean, obviously there's a lot of politics involved in this topic.
Sure. I think there are a lot of questions that are arising due to social media, due to politics, and it's right to have the questions. I think we have to then delve back into the data, the studies, all of the good information we have about how these vaccines prevent children from getting sick with these illnesses, and some of them are fatal illnesses. So we have vaccines. We know the ones that we're recommending are safe. We have good data for that. But yeah, there's a lot of questions coming up.
Let's talk about RSV, because I know
Sure.
you're saying that this is seeing a big increase right now.
Yeah.
What's the reason? How serious is that? What do people need to know?
Yeah, well, we expect an increase in RSV at this time every year. At the end of November, cases went up around 25% in New York, which is a significant bump. When we get the holidays and winter season, people together indoors, RSV is very transmissible. So we expect that bump. The concern for RSV, it's one of the worst viruses that I see in my patients in the hospital because of the injury that it causes to the airway, particularly in infants and small children. It can cause that respiratory distress, which can be very scary. Children come into the hospital, they can end up on ventilators with breathing tubes from this virus. So we really look out for it, we get concerned. And fortunately now, for those who are vulnerable, we've got monoclonal antibodies for children who are up to 8 months, any child can get it, and then up to 2 years, children who are susceptible or have immunodeficiencies can also be eligible.
What should people be doing to not get it and not get other viruses right now? Is it the same, washing hands, wearing masks, et cetera? I mean, what do you do to try to stay healthy?
Yeah, it sounds so simple to keep saying this like hand washing thing, but this is how these diseases spread, from germs on your hands. So washing your hands, covering your mouth when you cough, and really around the holidays, everybody wants to get together, of course, and they should. But if you're sick, just think about protecting the people around you. If you are sick, maybe not going to every gathering, staying away from other people a bit, wearing a mask if you're ill. But yeah, it's all those hand-washing things and protecting others.
There's another thing that sometimes happens this time of year with the holidays and with the lack of sunlight, and that's a more difficult thing, I think, to diagnose, and that's seasonal depression. Are you seeing more of that in your practice?
It's very common. I think even around the holidays, there's this expectation that everybody's joyful, that everybody's having a great time, and it can be a difficult time for a lot of people. And the lack of sunlight and the cold tends to exacerbate that. So yes, through the holiday season and then afterwards into the new year, it really is a problem, and it's something that as physicians we keep in mind to ask our patients how they're feeling. But also to just check in with family members, friends, ask how they're doing. If people seem to be having a hard time, maybe check in with them and see. Yeah. There are a few things to keep in mind, in terms of dealing with that. Trying to get exercise, good nutrition, getting outdoors into the light sometime during the day is also a really great idea if you're starting to feel like it's affecting you.
Yeah, no, good point. When's the time to do more than that?
Yes. So any time that you have a thought or an idea of hurting yourself, or someone's saying that to you, that they're thinking of hurting themselves, that's like get medical attention immediately then. And if you feel like you're more tired than normal, not enjoying things that you normally enjoy, unusual difficulty getting out of bed and you're just not able to do the things you want to do, there's help available. So talking to a physician, talking to a friend, and getting some help.
Always such important advice. Dr. Susannah Hills from Columbia University Medical Center. As always, we really appreciate it.
My pleasure.